Hello, my name is Christopher Jamie, and today I will be demonstrating the intradermal injection technique. It's for a tuberculin skin test. I will be performing the skills videos today. So the supplies. Oh, this is my badge, and the supplies that I have with me are a set of clean gloves, syringe, medication vial, alcohol swabs, and gauze, and a sharps container to dispose of my syringe after use. Okay. So, I will begin this video by verifying the healthcare provider's orders, and I'm going to go ahead and verify the 6 rights of medication administration. Starting off with right patient, right drug, right dose, right route, right time, and lastly, right documentation. Once I'm done verifying all 6 of those, I will go ahead and check the patient's EHR, and I'm going to verify the the order of in the MOR. And once I verify the order in the MOR, I'm gonna go ahead and read that the doctor has ordered 5 tuberculin units intradermally, which is supplied in 5 units per 0.1 milliliters. Sorry. So today's dose will be 0.1 milliliters. Okay. So now I'm gonna go ahead and gather my supplies and enter my patient's room. I'm going to go ahead and close the door behind me to ensure patient privacy. I'm going to go ahead and set down my supplies on a clean, flat surface, and I will now go ahead and hand hygiene and introduce myself to my patient. Hello, my name is Christopher, and I will be your nurse for today. Once I've introduced myself, I'm going to go ahead and ask the patient for their information. May I have your first name and last name and date of birth, please? Once they give me the information, I'm going to go ahead and verify on their wristband. And at this time, this is going to be my second time checking to see if the medication checks out for the right patient. Okay. Mr. John. Oh, this is going to be my 2 identifiers too. Mr. John, do you have any allergies by any chance to medication, food, or any environmental allergies? Patient states no allergies, so nothing to worry about there. Okay, now I'm going to go ahead and perform hand hygiene. And I will apply my gloves. Gloves are on. Okay, thank you, Mr. John. Now your doctor has ordered a tuberculin skin test, otherwise known as TPD. Okay? This checks if you've been exposed to tuberculosis bacteria. So what's going to happen today is I will inject a small amount of fluid just under the skin, okay? We will check the site in about 48 to 72 hours just to see if there's any reaction, okay? Some common side effects that you should be aware about, it's just mild redness, itching, bruising, or even swelling. Now, some adverse effects are hives, rash, fever, or difficulty breathing. If you experience any of these, please report them immediately. Okay? Alright, so now you might feel a slight burning or stinging sensation during the injection. It's completely normal. Now, I will allow the patient to ask any questions. Mr. John, do you have any questions? No? Okay. Now I'm going to go ahead and prepare the medication and verify for the 3rd time just to make sure that it matches up to the right patient, which is very important. Now I'm going to go ahead and remove the cap of the medication vial if new. Since I already been practicing, it's not. So I'm gonna go ahead and take a alcohol swab. Dispose of my trash. I'm gonna go ahead and clean the top of the vial, like so. Dispose of this in the trash. Okay, so now the syringe that I have here is a 1 milliliter tuberculin syringe with a 25 gauge and a 5/8 inch needle. I'm going to go ahead and remove the syringe from the package, and I'm going to fill it up to 0.1 milliliters of air. Alrighty. 0.1 milliliters of air. You can see that. Okay. So now I'm going to go ahead and remove the cap and inject the air into the vial, to the medication vial. Now I'm going to invert the medication vial and draw the same amount, which is 0.1 milliliters. Okay. Check for any air bubbles. No air bubbles are present. If there are, you're going to go ahead and tap and push out any bubbles if there's any present. Now I'm going to go ahead and do the swoop motion or method. Alright, there's my 0.1 milliliter of medication. I'm going to set this down. Now what I'm going to do is I'm going to go ahead and select the site where I'm going to inject. So it's recommended that you do 4 fingers below the antecubital space and 1 hand space width above the wrist. Okay? So preferred area is here, which in this case is my prop. I'm going to go ahead and inspect for any lesions, discoloration and tenderness, and I'm going to go ahead and palpate. All right, area seems good. Now, if one forearm is not available, I can go and check the other one. If both are not available, I'm going to go ahead and use the upper back. Okay. Now, Mr. John, thank you for letting me assess your arm. Okay. Now I'm gonna go ahead and clean your arm with a piece of alcohol swab. Drop that. Okay, some alcohol swab. Now when I clean the site, I want to clean inwards to outwards 2 inches. Dispose of this. Now I'm going to go ahead and let that air dry. I do not want to touch the site. Now I'm going to go ahead and I'm going to go ahead and notify Mr. John that I'm ready to inject. Okay, Mr. John, I'm going to go ahead and inject the medication. I want to go ahead and get the syringe. Hold it like a pencil. Remove the cap. Like so. And now at a 15-degree angle, I want to hold it with my dominant hand. With my left hand, I'm going to go ahead and stretch the skin. I want to make sure that the bevel is facing upward, like so. And now, at a 15-degree angle, you want to go ahead and inject and advance 3 millimeters into the dermis. Now I'm going to slowly inject the medication. You should feel some resistance. If you don't, that means you went too far past the dermis. Okay, you should see a small bevel or a mosquito, something that resembles a mosquito bite. Now you're going to get a gauze and slowly, gently apply the gauze while removing the syringe. I'm going to put the safety cap onto the syringe and discard into the sharps container. I'm just going to leave it here for now. Okay, I'm going to go ahead and check to see. You don't want to massage when you put the gauze, and you're just going to check for bleeding. If there's bleeding, your patient's going to need a bandage. Since there's no bleeding here, no bandage is necessary. Okay, so Mr. John, everything okay? How are you feeling? Patient feels good. Okay. So we're gonna go ahead and check this site in 48 to 72 hours. Okay, we'll be checking you periodically between now and then. But just so you know, we're gonna check in 48 to 7 hours for results. Okay, I'm gonna go ahead and remove my gloves. Discard. Perform hand hygiene. Okay, now I'm gonna take my remaining I'm going to make sure my patient is comfortable. If they have any other questions, provide the call light and gather my remaining supplies, exit the patient's room, and I'm going to go ahead and document everything that happened today. Okay, thank you for watching.